So this would be a good time to review what some of our overall recommendations to our patients would be.
Before we start our recommendations to our patients, I think we should talk about stress, because stress, like I said, is one of the heads of the dragon, and it's actually a major impediment in people trying to follow the lifestyle recommendation. Life is stressful. We had COVID. People are facing a lot of changes. There are financial problems, and we have a whole endocrine system in us and a sympathetic nervous system that are there to respond to it in a form of anxiety. And anxiety can be good too, because it's a driving force, but it becomes overwhelming, and people have hard time fighting it, and as a result, the biggest comfort is eating.
So you talk about the fight or flight mechanism and the way we respond to it.
Right, right. It's like a tiger that is running after the person who's just sitting in front of the computer. The adrenals are going crazy. The sympathetic nervous system is going crazy. And guess what? What is the easiest thing? Is
stress eating.
Stress eating and watching something. So certainly when we recommend lifestyle interventions, those should be directed in three different directions. It should be improving the diet, it should be exercise, and it should be controlling stress.
Do you direct your patients away from the serious time wasters like social media?
That would be a good idea. Please stay away from too much social media, because that's also definitely increases stress, and it's not an exercise. Well, get up and exercise.
It's sedentary for a very long time.
It is a sedentary, but let's talk about impact of sedentary lifestyle and what happened to us as humanity, as Homo sapiens, since we stopped working on the outside, just like our hunter ancestors were running after the tigers and getting their food and things like that. We turned into very sedentary creatures, and there is a phrase that says, sitting is the new smoking.
Explain that.
Since sitting for a long time, more than 90 minutes decreases your metabolism, it basically makes you
insulin resistant.
Insulin resistant. The best way, since carbohydrates are our fuel, and we are using carbohydrates, our muscles are using carbohydrates as energy, we need to move to use this energy. Otherwise, certainly the sugar that we're consuming is turning into fat or fatty liver. So that
we could also use exercise as a response to stress, or a way to manage the stress.
Absolutely, absolutely. Exercise is extremely important for everything, and I'm gonna talk a little bit about the importance not only for adults but also for children. For the bone formation, for producing growth hormone, exercise stimulates growth hormone production. For many other things, children, for their academic even success, children need to exercise, because if the kids should be exercising in team sports and all kinds of sports, running, for adults there is probably a better exercise is walking, yoga, tai chi. Certainly those who have been running their entire life, they can continue running, hiking. These are excellent types of exercises, and they impact every aspect of our lifestyle, from our metabolic rate to our improved sleep to improving genes. Epigenetically, exercise unveils good genes, versus fat will unveil bad genes. So importance of exercise is extremely important in general health for bones.
So what kind of techniques are available to our patients who want to address a stressful lifestyle?
Well, there are certainly mindfulness classes that people can attend.
Mindfulness, what is that?
Mindfulness is being aware of your own self, of your health, of your environment. It is also treating your health, your family health, and environment in the same way that taking into consideration. Importance of stress control is paramount for lifestyle, because unless the stress is controlled, it's going to be very hard for the person to improve their eating habits. So again, be it a professional counseling, peer groups, CBT, cognitive behavioral therapy, those are all very important. Social relationships are extremely important for stress relief. We know that people who are more social, who are,
Who have a sense of community,
yeah,
belonging.
who have sense of community and belonging, that correlates with longevity and also quality of life.
You talked about sedentary lifestyle being the new smoking, but also loneliness is kind of an equivalent risk factor to smoking.
Yeah, that's true. That's true. So certainly the hiking groups, the meetups, anything that can help you, dance classes, going dancing, that's both a stress relief and a physical exercise.
Community activities, church activities, cultural activities, family
Travel,
activities.
vacation, all of those things are very important for stress management.
And
Thank you.
longevity.